So getting these guys back out into the greater community versus the recovery community is another thing that's going to have a lot of sticking power on whether or not this guy has some long-term success, right? Because it's great to do well in this little bubble that they're in and they have their peers and things like that, but how are they bringing that into the outside world? And what we do, or what any good long-term aftercare facility would do, is helping them on the life skills area, because a lot of these guys, that they're a younger demographic, or they're people that are less responsible demographic because their primary responsibility is taking care of their substance abuse disorder. They haven't done things like gotten a resume. They don't really know the ins and outs of applying for a job and going on interviews, right? And remaining accountable to a boss, like all these sorts of just basic life skill things that have been neglected. Again, goes back to model and behavior of the clients that have done it, as well as the people around them, staff-wise, that they're seeing, that are recommending, like, hey, this is how you get back into the community. This is how you really be like a productive, functioning member of society. And then just like there was a warm handoff when they came to us, it's almost like us giving them a warm handoff back into society, right? They start going on these job interviews. They start to try to figure out the balancing act of overworking / not getting their needs met in life, right? And that's what we are. We're guides along the way to kind of point out, like, hey, this lack of work isn't really good for you, or this overworking seems like it's kind of taken away from the emotional side of things that you're working on right now. Let's meet somewhere in the middle and come to some sort of reason to really just be, in a sense, a well-oiled machine of a human, right? In the healthiest way possible, right?